In this video, we will be discussing marijuana use among young adults and the potential impacts it can have on oral health. Cannabis is most commonly known as marijuana, and it is one of the most common drugs used in society. With the legalization of marijuana, there is an upward trend in its usage. Marijuana is most commonly smoked and enters the bloodstream and affects the body through endogenous receptors, which leads to effects on almost every system of the body, particularly the cardiovascular system, respiratory system, and the immune system. Marijuana has significant impacts on our mental health, physical health, and oral health. Looking at a study that asked adolescents and young adults about how frequently they use marijuana, it was found that 17% of the population were abstainers, meaning that they never use marijuana. 59% have tried marijuana and may occasionally use it. 17% use marijuana at least once weekly, and 7% were considered cannabis dependent. They were classified as cannabis dependent based on having persistent desire, experiencing withdrawal, and spending excessive amount of time using. The high rates of marijuana use show how relevant this topic is and the need for more information on marijuana use and potential negative effects on oral health. Now we will look at some of the oral health implications that marijuana has on our oral health and how we can minimize those effects. Generally, marijuana users have poorer oral health than non-users with higher decayed, missing, and filled teeth, as well as higher plaque scores and more gum disease. There are also more specific problems caused by marijuana use. First, we will be looking at the effects of cannabis smoke on our oral health. Cannabis smoke acts as a carcinogen, which is a substance that is capable of causing cancer in living tissue. This can cause dysplastic changes, which are abnormal cells that are not cancer but can become cancer, as well as premalignant lesions, which are areas of altered tissue that are more likely than normal tissue to develop cancer. This occurs on the oral mucosa, which is the skin inside the mouth, including the lips and cheeks. These images show what the oral mucosa could look like after the effects of cannabis smoke. Next, we will discuss xerostomia, which is another negative effect of marijuana use on our oral health. Xerostomia is chronic dry mouth caused by a low flow of saliva in our mouths. Having xerostomia puts individuals at very high risk for developing cavities and tooth decay. Xerostomia can also make it difficult to speak and swallow due to having very low saliva and no lubrication of the tissue in our mouths. Xerostomia can also cause problems with eating as there is no saliva to mix with our food, making them challenging to tolerate and chew. Xerostomia can also cause lips to become cracked and dry. Marijuana use is associated with increased gum and bone disease. Gingivitis is a milder form of gum disease which is characterized by red, swollen, and bleeding gums. Gingivitis is reversible, but can also eventually progress to periodontitis if oral health care is not improved. Periodontitis is a more severe form of gum disease which is irreversible, as it has caused bone loss and damage of the tissue surrounding the tooth, which leads to decreased support around the teeth and can eventually lead to loose teeth or tooth loss. Now we will discuss things that can be done to prevent some of the negative effects caused by marijuana use. One way to prevent the negative impacts on oral health is to decrease the use of marijuana. Cessation counseling can help individuals who are interested in stopping use. Dental professionals are also in a good place to deliver this counseling to their clients and can provide behavioral and pharmacological support for cessation. Dental professionals should bring up cessation counseling to see if the client is motivated to make a change. Another way to prevent the negative impacts of marijuana use is improved self-care. If using marijuana, it is especially important to have good home care. This includes always brushing with proper technique for 2 minutes twice a day, as well as cleaning in between the teeth. Another way that can minimize the effects is to increase education about the potential negative impacts. It is important to ask clients about their use of marijuana and provide education on the impacts it can have on our oral health. There is also a need for more interventions regarding marijuana use and oral health, as there currently are none. Some existing interventions, such as counseling services, support groups, and addiction treatment centers, can be used regarding the effects of marijuana use in general. Another way to minimize the negative effects is to go for regular dental visits. Dental visits need to be done when the client has not had any marijuana recently, as there could be potential drug interactions and the inability to consent to treatments. However, regular dental visits will help decrease the progression of periodontitis and gingivitis, and the dental professionals will complete an oral cancer screening to monitor if any changes of the tissue have taken place, as well as monitor for other potential impacts such as xerostomia. Marijuana use is very prevalent today, and little research has been done on the negative impacts it can have on our oral health. With this video, we hope to increase education surrounding what those negative impacts are, such as xerostomia, gum disease, and oral cancer, as well as what can be done to minimize them.